Good morning.
Good morning.
President Elam had a conflict this morning and was unable to attend. He asked that I give remarks or opening remarks on his behalf. On behalf of President Elam, I welcome all of you to our lecture series today with Bruce Robistow, Halifax County Health Director. Mr. Robistow has been working in our community to reduce and eliminate COVID-19. We look forward to hearing what he has to say. Next, Miss Abigail Fleming, a pre-nursing student and Phi Theta Kappa Honor Society member, will introduce our health director.
Good morning. Mr. Bruce L. Robusto is a native of upstate New York. He served in the Navy for 8 years as a combat medic. While in the Navy, he was stationed at Camp Lejeune and fell in love with the state. After being honorably discharged, he worked in hospitals as a respiratory therapist and manager of cardiopulmonary services. Before becoming Halifax County's health director, he was the vice president of clinical and support services at the former Halifax Regional Medical Center. Mr. Robusto has an associate of applied science in respiratory therapy from Hudson Valley Community College, Bachelor's of Applied Science in Management from Mount Olive College, which was later renamed the University of Mount Olive, and a Master's of Public Health with an emphasis on public health policy and management from the University of North Carolina at Chapel Hill. Mr. Robusto is married to his lovely wife, Kathleen, of 45 years. Together they have 2 children, 4 grandchildren, and 3 great-grandchildren. Thank you.
Thank you very much. That was a wonderful introduction, and hard to believe I've been through that much already.
Well, thank you, Miss Abigail, for introducing our speaker with us this morning. Our viewers today will have the opportunity to participate in a question and answer period. You can submit your questions during the presentation by clicking on the Q&A on your screen and submitting your questions. After Bruce Robistow's presentation, I will ask questions on our viewers' behalf. Mr. Robistow, the floor is yours for your presentation. Thank you.
Thank you, Ms. Mack. Again, I really appreciate the opportunity to share information regarding COVID-19. As I'm sure you realize, numbers have improved considerably in the last couple of weeks in Halifax County, throughout the state, and throughout the country. Many different states are replying or responding to the changes, the improvements in different ways. It's vital that we stay ever vigilant in regard to COVID-19. Although we are doing well, the battle is far from over. There's a lot of work that still needs to be done. Some states have lifted all restrictions, especially with the masks, and that's concerning to me, as COVID is far from gone. It requires about 70% of the population in this country, in our state, in our county, 70% of people to be vaccinated before we can reach a herd immunity that will make it so we can get back to some semblance of normal. Herd immunity is a way to defeat a virus, to keep it from spreading out of control by us being able to have antibodies that will protect us. The COVID-19 virus is an interesting virus, as it is evolving as we battle it. That you may have heard that there are different variants of COVID-19. And, evolution has happened throughout the history of the world. And, but normally evolution takes a long time. If you look at birds, they're descendants of the pterodactyls. That took millions of years before they evolved into what they are now. Well, the COVID-19 virus is evolving quickly. And what that evolution means is that what we started fighting is changing. The new variants can be spread easier, can be spread quicker, and can be more deadly. Another reason why we need to continue to make sure that we're getting vaccinated. And the biggest way to prevent, until you're fully vaccinated, the best way to prevent spreading of COVID is for everyone to practice the 3 W's, which I'm sure you've heard of before, but that's to wash your hands regularly and to wait 6 feet apart and to wear a mask. The majority of masks that are worn to prevent the spread of the virus, not as much to protect you from getting the virus. There are masks out there that can protect you from breathing something in. Those are the N95s that you've heard about. However, the best way for us to combat this is to everyone to wear a mask, and we prevent the spread to each other. All right, I'm going to go ahead and give you an update of the where we are now. This is an update that I give monthly to the Board of Health, and I also provide this information to the Board of County Commissioners as well. You know, the Board of Health is who I report to under their guidance. The health department manages multi-facets of healthcare, public health. Public health involves many things, from animal control to environmental services such as well water and septic tanks, and ensuring that everyone is safe. We have a clinic here. We're responsible for managing rabies. We do a lot of different education in many different venues, such as in schools and organizations, and on all types of media as well. You'll find that the health department has a website on the county website, as well as a Facebook page that gives updates on all the different things that we're working on. Through this pandemic, we have been giving daily updates Monday through Friday as the state provides information for us to share. I would like to share a PowerPoint presentation, if I could have some guidance on how to do that. Okay, thank you for your patience as we navigate this. All right, again, this is our monthly report from the Halifax County Health Department. And you'll notice on the bottom of our sign, this is the sign that we have in front of our building. I've added that heroes work here. I would be remiss if I didn't share a high level of gratitude to the great team of people that I work with here at the Halifax County Health Department. It has virtually been a 7-day-a-week process for the last year. And our team, although has never been through a pandemic before, has been doing a great job working with many community members to protect the public health of Halifax County. All right, restrictions that are in place presently. I'm sure you're aware that throughout this pandemic, we've had different levels of restrictions that have been imposed by the governor. And the governor has done a great job working with Dr. Mandy Cohen of monitoring the data and effectively changing the restrictions as we either our numbers worsen or improve, however it is the case. And with the recent improvements that we've seen, effective 2/24/21, we've had a modified stay-at-home order lifted that required people to stay at home and businesses to close the public between 10 p.m. and 5 a.m. And it required face coverings in all public settings, allows many businesses to operate at 50% capacity. And now we've extended the on-site service of alcohol until 11 p.m. Lifts the 100% cap on some businesses that were operating at 30% capacity. It allows for some indoor businesses, including bars and taverns, indoor amusement parks, movie theaters, and indoor sports arenas to open at 30% capacity with now a 250 person capacity. So now we're able to have a few more events out there. It allows larger indoor arenas with a capacity of more than 5,000 people to open at 15% capacity with no cap, as long as additional safety protocols are in place. And again, and making sure you have hand washing stations, making sure that when there's any congregation that their masks are being worn, etc. There's increases in the indoor mass gathering limit to 25 people. The outdoor mass gathering limit remains at 50. So although we're not back open fully because of the improvements that have been taking place, some of the restrictions have been lifted. In order to get the data, we have to do an awful lot of testing. Laboratory testing it continues to be done throughout the state with turnaround times averaging up to 2 days. There are rapid tests that can be done that can have results back in as quick as 20 minutes. But the most accurate testing is the one that is sent to the state, and it takes up to a couple days to get those results back. The state is randomly taking some of those specimens that are sent, and that's how they're doing evaluations regarding any of the variants that might be out there as the virus evolves. Testing is widely available across the state, and anyone who has symptoms or has been exposed to someone that is positive for COVID-19 should get tested. Then what happens after somebody is determined to be positive, if they're determined to be positive, we go into what's called contact tracing and investigation. We call each and every person that has been tested positive for COVID, and we kind of trace their actions over the last couple of weeks. If they had been to an event, for example, church, or where do they work, and things like that. And so that way we can determine who else we may need to reach out to determine if they are symptomatic or if they need to isolate or quarantine. And while we're talking about isolation and quarantine, the basic difference between quarantine and isolation, at quarantine, it's strongly recommended that you stay home and keep yourself separated from the general public and even those in your family, where isolation is mandated and enforceable by law. And we've had very little issue with people not following isolation orders. However, we have had a couple, and in the event that someone does not follow the isolation order, then I would send a letter of final warning with the information that I would be exercising laws, and that person would actually be could be incarcerated to protect others from the spread of COVID. So it's very serious business. And so when we do this contact tracing and investigations, we do not, and we call around. If you're positive and we spoke with you and you let us know who you had been around, we will contact these people. We will not tell them who is the positive person. There are so many federal laws that protect your privacy that we would not call and say Joan Smith was tested positive and they need to get tested. We would just say that they had been potentially exposed, and but none of your private information would be shared. There are personal protective equipment, the masks and things like that. We started out with difficulty with supplies when this pandemic first broke out, but now there is plenty of PPE, protective personal equipment or personal protective equipment, available to the general public, businesses, and healthcare providers. All righty. The COVID-19 trends, the trajectory in COVID-like illness, CLI surveillance over the last 14 days is steadily decreasing. Our lab confirmed cases over the last 14 days are decreasing. Our trajectory in percent of tests returning positive over 14 days has decreased. And our trajectory in hospitalizations over the last 14 days is also decreasing. And so that being said, with the improvements that are taking place, there's been so many sacrifices that we have all had to deal with, but a big one, a huge one that's probably affecting you directly and possibly indirectly as well is education. And with the improvements that are taking place, there are finally some guidance and direction in regard to opening schools. So the Roanoke Rapids City Schools, pre-K through 5th grades are returning to in-person learning under Plan A beginning on 3/16, which is tomorrow. And 6th through 8th grade returns to in-person under Plan B. So Plan A is everybody's back in school. Plan B is some form of both returning to school in person and electronic or distance learning as well. So 6th through 8th grade returns to in-person under Plan B, 5 days a week on alternating weeks in 2 cohorts beginning tomorrow. The 9th through 12th grade beginning 3/16 or tomorrow, the return to in-person under Plan B, and students will be divided into 2 cohorts with cohort A attending in person on Mondays and Tuesdays, and cohort B attending in person on Thursday and Fridays. Wednesdays would be a virtual day. Halifax County Schools, pre-K through 5th grades, return to in-person learning under Plan A today. So it's an exciting day for a lot of parents, a lot of students, and a lot of teachers. The 6th through 12th graders will return to in-person learning under Plan B effective 3/22, which is next week. And Weldon City Schools, pre-K through 12th grade returns to in-person learning under Plan A beginning March 29th. So all school districts have option C, or remote learning, available for students whose parents or the students would elect to stay in option C. So everybody's situation is different, so they wanted to leave that option available to anyone who the parents or the students did not want to step into the in-person learning. As of 3/12, the Halifax County Health Department reports the following. We have 28 new positive COVID-19 cases reported since Friday, March 5th. That's an average of 4 people per day testing positive, which is an incredibly low number that we're pleased about. I'm sure would like to see it 0, but we've had as many as 60 plus positive cases in one day. So far in the last year, we've seen over 5,059 total positive cases. Since March 5th, sadly, we've added 5 additional deaths. And to to date, we've had a total of 102 deaths related to COVID-19 here in Halifax County since the pandemic started. So 2% of all of our positive cases have resulted in death here in Halifax County. And this is by zip code where the cases of COVID have happened. And you have to remember that some zip codes do overlap into different counties. But again, it's pretty commensurate with the population of each area. You'll notice that Roanoke Rapids, that does have the largest population, also has the largest number of positive cases. So you can peruse through that and see what zip code you might live in, and that will give you an idea as to the positive cases in your zip code. All righty, electronic lab reporting, or percent positives. You know, as testing is variable, we want to get a better measure of our actual cases or positivity in regard to testing positive for COVID-19. So obviously you would think if we do more testing, we'll have more positive cases. So trending your positive cases could get complicated. So we decided to monitor the percent positives. Then no matter how many tests are done, that variability would be pretty much alleviated. And knowing the percent of positive cases gives you a better idea as to where we're trending. And this is a big number. Our goal was to try to get below 5% of all testing, 5% positive cases. We have been as high, if you look at the graph, we have been as high as 17.1% positive cases, which is an extremely high number. But if you follow the trend down to where we are now, you will see that we've fallen well below 5%. We're at 4.5% positive at this present time. So again, that's an exceptional report. And you can see how this started through the trend line. The black line is the trend line. You can see where we really spiked and peaked out in January, and now we've come down. And this is the case by date of earliest illness identification in congregate living settings. Congregate living is places like nursing homes, or there's assisted living homes. Could even be jails and prisons and things like that. So this shows whether the number of new cases associated with congregate living facility is growing. So we look at the total number of cases to see whether the proportion associated with congregate living is increasing or decreasing. So although the number of COVID-19 cases in congregate living peaked the week of January 30th, our numbers for the past week have decreased, which is great news. All right, Halifax County COVID-19 racial makeup. All right, so 41% of all the positive cases in Halifax County have been Black or African American. 31.8% have been white, 3% American Indian or Alaskan Native, 0.2% Asian, and no Native Hawaiian or Pacific Islanders. Other 11.1%, and unknown is 12.7%. And you may wonder why we have other unknown numbers to report. You know, we're not the only ones that do testing, or these are done by different labs. So not all the information is collected by some of the places that do testing. Your ethnicity is also noted here. Hispanic 1.8%, non-Hispanic about 58%, and unknown is 40.5%. And keep track of and pay attention to the fact that the Black African American population is the highest. And this is something that is a statewide and a nationwide and countywide, of course, a concern. We need to be able to reach out more to the minorities and to help to make sure that they're getting vaccinated and to make sure they're getting the information. So that's our target population in regard to positive cases. We want to take care of everybody, but we need an emphasis on this. All right. Cases by the earliest illness identification and age. This shows the number of new cases. This graph shows the number of new cases by age at diagnosis. Ages 25 through 49 and the 50 through 64 equally represent the largest groups who have tested positive in the past week. And overall, the trending of the 25 through 49-year-old has been high consistently. So you'll notice on this slide here that 36% of all positive cases are 25 to the 49-year-old group. And so this is a lot of your parents. This is a lot of your working folks that are out there. So the numbers are very high through the 25 through 49-year-old. And you'll notice as we go up in age, the numbers also decline. The lowest is the 75 plus age group. All right, the gender for cases is we do have more females, 56% versus 43.5% of males have tested positive. Halifax County COVID-19 death rate by race. Now, if you remember, our number of positive cases was much higher in the Black African American population, but you'll notice that the higher number of deaths due to COVID-19 have been in the white population, 45.5%, with 38.6% of the deaths being Black or African American, and American Indian and Alaskan Native 2%. So it's an interesting dynamic, and we'll also look at it by age as well. You'll see that in regard to the deaths in Halifax County, the greatest number is for the 75 plus years population at 62.4%. So you may remember when we started vaccinating, we were focused on healthcare workers as well as the 75 and older population. We then brought it down to the 65 and older population. Again, you'll see that the death rate was higher in those age groups. So those healthcare workers and the elderly were the people at the highest risk for death due to COVID. All right. The vaccine. So as we talked about earlier, I want to see everybody get vaccinated. The vaccine is the only way that we're ever going to get this under best control permanently, and that's to get us to a herd immunity. Halifax County is partnering with Rural Health Group, Drug Co Pharmacy, and many other organizations, Vited North, previously known as Halifax Regional, along with the Sheriff's Department, Roanoke Rapids Police, Halifax Community College, a great partner. We've all been working together to get the vaccines out the most efficient way that we possibly can. So right now we're vaccinating groups 1, 2, and 3. Groups 1, 2, and 3 have been being vaccinated, and we just added groups 4.1. Which are eligible to receive their vaccine this week. And that's for people with higher comorbidities that we'll be adding to our list. So we're doing healthcare workers, we're doing the anyone 65 or older, and we're also doing essential workers. And the way we that's group 3. The way we define essential workers, the simplest way is to summarize is those that actually leave the home to go to work and deal with the general public. So those are the folks that are that can be exposed or can expose to others. So that's the group that has been added most recently. And then starting this week, we'll be able to take care of those with comorbidities such as diabetes, lung disease, obesity, things like that. There are 3 vaccines that have been approved. We have the Pfizer vaccine, the Moderna, and the Johnson & Johnson. And as you may have heard, the Johnson & Johnson is a one vaccine or one shot deal, where the Pfizer and Moderna require 2 shots. The Pfizer and Moderna, you have to wait 1 month before you get your second vaccine. 2 weeks after your second vaccine, you're considered vaccinated and protected. The Johnson & Johnson is one vaccine, and 28 days after receiving that vaccine, you're considered vaccinated. And so far, we've administered over 15,000 doses in Halifax County, 10,488 of the first dose and over 5,000 of the second dose. We have a ways to go. We have an approximate population of 52,000 people in Halifax County. All right, the COVID-19 alert system. This is something we're also proud of. Halifax County is presently in the yellow tier. There are 3 levels that we monitor. Yellow means there's significant community spread. Orange means there's substantial community spread, and red means there's critical community spread. Halifax County was in the red zone for several weeks, and we just fell back to yellow due to our improvements in the last 10 days. So this is great news for Halifax County, for the citizens on how well they're doing, and for how well we're getting people vaccinated and getting the word out on how to prevent COVID. The alert system, the way the tiers are determined, the red, yellow, or orange, is to be assigned to the red or orange tier, a county must meet the threshold for case rate for that tier, and the threshold for either percent positive or hospital impact. So case rate, the number of new cases in 14 days per 100,000 people. We look at the positive case rate, the percent positives, and hospitalizations as well in each county. So recommendations to return to normal. We all want to get back to normal. Summer's coming. We all want to hit the beach or go on vacation. So number one thing, the 3 W's remain the greatest opportunity to reduce the spread of COVID-19. Getting vaccinated is the best way for us to get to herd immunity. So continue practicing the 3 W's after your vaccination, because you can still spread it. So until we get to herd immunity and get enough people vaccinated, we still need to continue to practice the 3 W's even after you're fully vaccinated. The CDC has come out with guidelines that do allow you to gather with friends or family. Let's say you want to have a few friends over to your home. If everyone has been vaccinated and it's been the appropriate amount of time after either your second vaccine or with the Johnson & Johnson, your first dose, then you're allowed to actually gather now without having to wear a mask. But if you go out into public, you still need to wear a mask because you could spread it to someone who has not been vaccinated. So we want to educate and communicate and lead by example. So if you're going to be working in healthcare or you're studying healthcare, it's important that you communicate this information to others and to lead by example. And the ability to gather with the fully vaccinated folks is as I explained, but you have to ensure that everybody's fully vaccinated before you can remove your mask in small private gatherings. So that was a lot of information. So I'm open to any questions. It's a very busy time working with COVID. So I appreciate your interest in learning about COVID.
Bruce, we did have a few questions
Okay.
that were submitted. So, first question we have comes from Timothy. Timothy asks, has there been any known COVID cases in animals, our four-legged friends?
There has been a couple cases that have been noted with some animals, with some dogs, but a very minimal number. There's not a lot of science out there to give us any real in-depth information on that. So it's a great question. Our family definitely has some beloved pets. We have a dog and some birds, but it doesn't appear that there's anything to be concerned with the animals, and there's been no proof that they can spread it.
Okay. The next question we have is from Sarah. When do you think the vaccine will be available for school-age children?
The reason it's not available for school-age children is there's just hasn't been enough studies to know whether it's safe for children or not. The upside of that is the fact that children don't get as sick when they get COVID, and smaller children don't spread it as much. But the Pfizer vaccine can be used on anyone 16 years of age or older, where the Moderna and the Johnson and Johnson, you must be 18 years of age or older. And those restrictions are set just because scientifically we know that it's safe to vaccinate people in those age groups. There hasn't been as much focus on the younger age groups, again, because the fact that they don't get as sick. There's been minimal deaths, thank goodness, in regard to children. And once we have data that says it's safe to give it to children, we'll be able to. But there's been no projection on when that information would be available. More of the attention is being focused now on the variants and protecting those at higher risk, which are the 18 and older population.
Okay. Next question is coming from Kenneth. Why do you, I think you mentioned this a little bit in some of your discussion, but why do you think the Black African American cases are so high in Halifax County, but surprisingly, whites have had the most deaths in Halifax County?
I think a lot of the death rate comes down to underlying condition or comorbidities. So it just worked out to where a lot of the people that died happen to be white and have the increased comorbidities. The reason that we've been able to glean why the African American population has the highest numbers is potentially for more congregate living, more people in a household, possibly smaller homes, things like that. But it has been of interest, the fact that although there is more positive cases in the Black African American population, that the death rate is higher with the white population. But it does come down to the comorbidities in congregate living as well. A lot of the deaths have been in nursing homes, for example. So I hope that answers your question.
Let me ask a follow-up to that question based on your response.
Sure.
How is that trended statewide in North Carolina? Do you know?
We do. It's pretty much trending the same. There is a higher case of positivity across the state in the African American Black population. The death rate, however, is variable. In some counties, it's similar to ours, where the death rate is higher. In other counties, the death rate is higher in the Black and African American population, with the rural counties being of some of the greatest concern.
Okay. The last question that we have, and I'm also looking, there are no more questions left unanswered on the what is it called? The form that we have here through the webinar. But the last question that we have is, and this is from Pamela, is there a preference in which vaccine a person should receive, and which vaccine has the worst reactions?
Great questions. Yes, there is a preference as to which vaccine you should have, and that is the absolute first vaccine that's available to you. There is no preference in regard to the vaccines. The Pfizer and the Moderna have the highest efficacy rate or effectiveness rate compared to the Johnson and Johnson. However, the Johnson and Johnson efficacy rate is substantially high. And where it's most important, or each of the vaccine is most important, is preventing serious illness or death. And they all rank in the mid to high 90 percentile in regard to efficacy regarding severe illness or death. So there really is no better one. The Johnson & Johnson, again, is one shot. So that's something that's being used in a lot of different settings as it comes available. We don't have any available in Halifax County. And I do have a lot of citizens that are saying, I'm going to wait because I only want one shot. I don't recommend doing that for a couple reasons. Number one, we need to do this as quickly as possible. Number two, when we finally get Johnson & Johnson, the soonest we will get it is the first week in April, and I don't know how much I'll get. So what we get a lot of is Moderna. And so the Moderna is the one that we get. If you get the opportunity to get the Moderna vaccine, I would get on it. I would get any vaccine you can get. They all work great. And I've been vaccinated completely with the Moderna vaccine. The second part of your question is which one makes you sicker? None of them have been shown to make you to have more ill effects than the other. And it's really variable how many people have side effects to the vaccine. I've had both vaccines from the Moderna. I didn't get sick at all. But several people that I work with, my wife that has been vaccinated, she got sick after the second vaccine. Some people get sick after the first. What the sickness is it's basically a response of your immune system, the antibodies, that are getting all fired up and getting ready to go to battle. So it just affects some people differently. So there is no best one in any regard. All three work well. All three are vital to get them as quick as you can, and all three have similar side effects.
Thank you for answering those questions that our viewers had this morning. We want to thank you, Bruce, for your virtual visit with us today and sharing information on COVID-19. We look forward to our continued partnership and having you back in the future for future events. We also thank everyone for participating in our lecture series today, the Global Diversity Committee for helping to organize the lecture series, Caroline Harris for technology and setup support, and Gary Redding for assistance with program design. On March 31st at 6 p.m., we will be hosting our Progressive Community Awards ceremony honoring those fighting COVID-19 in our service region. On April the 1st at 10 a.m., virtually, we will have Mr. Charles Jackson, Northampton County Manager, and he will share information on local government, including career opportunities that are in the field. We are planning an end of the year activity for our students, and more details will be coming soon. We want to thank everyone for attending our virtual event today, and we look forward to seeing you again at many of our cultural learning and universal enrichment events. Enjoy the rest of your day. Continue to be safe. Again, we thank you, Bruce, for coming out and sharing this information with us today, and this concludes the end of our program. Thank you.
Thank you.